is Mary Galantino, and today I'm going to be giving a presentation on styles of learning and what you, the RN tutor, needs to know. First, we need to start with some objectives. Hopefully, by the end of this presentation, you'll understand the VARC styles of learning model. You'll learn which tutoring strategies are effective for each type of learner. You'll be able to identify the challenges that each type of learner faces. You'll be able to incorporate tutoring strategies and activities as they relate to the VARC model. And finally, understand how to individualize a tutoring session based on the 2T's learning style preferences. The VARC model was developed by Fleming and Mills in 1992. And it's the idea that people learn in different ways. The VARC model stands for visual, auditory or oral, reading, writing, and finally, kinesthetic. Visual learner learns by seeing. Demonstration and description for better understanding. Use of lists help organize ideas for these individuals. They appreciate outlines of information. They use charts, graphs, maps, and algorithms. And finally, they can easily lose focus with extraneous movements or actions. Next, the auditory learner or the oral learner. They learn by hearing. These individuals focus on the words spoken. They prefer listening to lectures and less on taking notes. They process content by speaking to other people. They use recordings to understand concepts. And finally, they are easily distracted by a noisy environment. Next, the reading, writing learner. They learn by reading. They focus on reading the printed word or text. They prefer textbooks and lists. They tend to paraphrase classroom notes. And finally, they are profound note takers. The kinesthetic learner, on the other hand, they learn by doing. They use all of their senses to help learn. Experiences help them understand content. They dislike learning merely by listening or visual methods alone. And they tend to be very passive learners in lecture environments. Now, you as the RN tutor, how can you use the information and the different ways that people learn in order to provide a better tutoring experience? It's easy. Try to tailor your tutoring to the type of learner that you're working with. Now, this may be very difficult in a group setting, but one-on-one, as long as you can identify how best that student learns, you can try to tailor activities that are more likely to suit their learning style. Fleming and Mills also discussed that people don't generally learn by one primary method. They often have more than one method. And so taking that into account, you as the RN tutor can use different strategies. Tutoring the visual learner. You want to think about the use of concept maps. You want to use algorithms to understand decision-making processes. And you want to highlight the importance of using different colors to remember terms and concepts. Concept mapping. This is not new to nursing. I know that when I was a student in nursing school, I did concept mapping all the time, and I'm sure you can relate. Concept mapping is a visual representation of information. It shows concepts, ideas, and the relationships among them. Students may ask you to help them with a concept map, as many teachers require concept mapping as a form of evaluation. The slide here indicates just one type of concept map that can be used, the spider effect. You can use block style concept mapping. Whichever way the student learns is the way you can organize the concept map. It doesn't have to fit a particular format or a particular way. Whichever way helps the learner understand better is the one that should be used. Algorithms. As nurses, we use algorithms all the time, especially when we're talking about resuscitation measures. Think about BLS and think about ACLS. Algorithms are a process or set of rules to be followed to help in problem-solving operations. It's a flowchart approach to healthcare decision-making. The example on the slide is an algorithm to determine how best to treat a heart failure patient. You can use this algorithm to help the student better understand interventions and medications and treatments for heart failure. Finally, the use of diagrams and color association. Many visual learners associate what they see with concepts so they can remember. Colors can help associate content. Diagrams provide a visual aid to recall information and content. And finally, creating the diagram alone helps the learner understand the content. Here is an example of a diagram and color association activity that I've utilized when I've taught pharmacology in the past. I try to relate colors to the body system. For instance, red is cardiac. Pink would be respiratory. Neurological would be gray, so on and so forth. If the student is primarily a visual learner, these color associations can really help them remember content and recall information. A blank diagram and color association activity is available in your tutoring toolbox. Next, tutoring the auditory learner or the oral learner. Remember, when tutoring the auditory learner, think about talking it out. Use think, pair, share, and consider the importance of using recordings. Talking it out. For the auditory learner, this is essential. They learn best and understand new content through listening and speaking. They love the use of mnemonics, as well as the fact that you need to encourage students to teach the information to others. Think, pair, share. One of our previous presentations, you hopefully have learned about think, pair, share. But if not, know that think, pair, share is a collaborative learning strategy. It requires the student or the learner to think individually about a topic or concept first, and then share that idea or process that idea with a classmate. Talk it out. Potential activities that you as the RN tutor can utilize in a think, pair, share format would be a case study discussion. Math problems, explain the process. Make that student show the other student exactly how the steps and the formula are written to come to a conclusion. And finally, NCLEX practice questions are extremely helpful in a think, pair, share environment. The oral learner also appreciates recordings. Now, you need to make sure that you understand your university or your organization's policy on the use of recordings. However, if it is permissible, allow that student to permit recording of your tutoring session, both if they happen in person or virtually. Encourage your student to record classroom lectures, if possible, and remind students that recording lecture notes can also be helpful. As simple as them reading their own lecture notes, recording it, and listening to it again. Next, tutoring the reading writing learner. Remembering that when tutoring the reading writing learner, encourage students to take notes. Utilize PowerPoint presentations to better present information. And finally, consider making NCLEX style questions. Keynote. Students should be encouraged to take notes during the tutoring session. You want to encourage the students to write and rewrite their notes from class and tutoring sessions. This has remarkable benefits. Simply writing over and over again can help the reading writing learner understand, remember, and recall. Also, help students organize organize information into lists. The reading, writing learner appreciates lists. They learn effectively from them. Finally, PowerPoint. You want to create a PowerPoint to try and help the student better understand content. Now remember, reviewing the PowerPoint necessarily won't be important visually for this type of learner. But if you're able to integrate symbols, diagram, and lists within the PowerPoint, this can really help the reading, writing learner. And especially if those PowerPoints can be printed out and given to the student. Encourage students to take notes on PowerPoint slide handouts. NCLEX question. The thing that we all would struggle with as students. Consider making NCLEX questions to help these students practice. Help them get familiar with the questions they may see, which will help diminish their test anxiety and also help them perform better. It's not just about getting the correct answer. Why? It's more about getting them to understand the process and how to arrive at the most correct answer. So where as the RN tutor do you get questions? Well, depending on how long you've been doing this, you could make them up. There are multiple online resources, and your tutoring toolbox has a plethora of NCLEX questions that have already been created for you that you can utilize. Lastly, tutoring the kinesthetic learner. Remember, the kinesthetic learner likes to do, and they like to utilize all of their senses in order to understand content. Practice simulations with these learners. Utilize real-life videos and experiences. And finally, consider active learning methods. Simulations are a great way to engage the kinesthetic learner. It doesn't have to be extravagant or expensive or even require the greatest of technology. Go to a Goodwill or clean out your bedroom closet. Try to find props and elements that can be used to help bring a situation to life. You can utilize technology to present a simulation, of course, and also role-playing can be utilized during a case study. Have someone be the patient, have someone be the doctor, have someone be the nurse. Case studies in and of themselves can be an excellent learning tool, but for the kinesthetic learner, it can be very hard to focus during a case study review. The use of simulation and role-playing during the case study can engage the most passive learner as well as the most active learner. Real-life experiences. Luckily, thanks to video sharing platforms like YouTube and Rumble, there are a plethora of videos that can be used to help teach or bring about understanding to a concept. You can actually show actual medical experiences and procedures. I can't tell you how many videos are available on cabbages, percutaneous coronary interventions, on physical assessments. Make sure the video is not too long, especially for the kinesthetic learner. They may lose interest quickly, and therefore the video may not be a successful learning tool. Finally, active learning. Active learning, get those students up and moving. Engage and create interactive activities that tend to be on the higher level of Bloom's taxonomy. And most importantly, think about the use of games. Platforms like Play Factile or Jeopardy Labs or Kahoot, just to name a few. If any questions or suggestions for improvement of this presentation, I ask you to email and direct them to the tutoring services at your organization. I thank you for your time, and I hope you have a wonderful day.